That's going to make the blood vessels dilate and accommodate more blood flow. Zinc is important for testosterone production, and vitamins B9 and B3 support vascular health. Now, all of these, you must use them as directed. I would get medical grade supplements that you know that the active ingredient is in there and that they are accurately dosed, and you don't want to overdose on these, especially the B vitamins. That would not be good. Welcome to LifeSculpt by ChristiMD, the podcast where we delve into the art of living your best life. I'm your host, Dr. Christi, a board-certified urologist, wellness enthusiast, and author of the BioVitality Blueprint, and your guide to transforming health and happiness. Here we explore cutting-edge health trends, chat with inspiring guests, and share practical tips to sculpt the life you've always dreamed of. So grab your headphones, get comfortable, and let's dive into today's episode. Experiencing changes in your sexual health as you age, men, you're not alone. Women, is your husband not satisfying you the way he used to? You're not alone. Sexual health and aging, what every man should know. How can we optimize our sexual health as we age? I am here to say that aging should not mean that we stop having sex and that we stop enjoying it. It is something that we can continue to enjoy throughout our lives. And while there are some challenges that come up for men as they age, women as well, of course, there are many treatments and options that you can utilize and tap into so that you do not have to give up on that part of your life. And women, if you are listening to this, tune in, because if your husband is struggling with this, he may just need a little nudge from you. And let him know that this is important to you and get this addressed so that you guys can get back to the intimate health and life that you enjoyed in the past. So, what are some of the age-related sexual health conditions that men experience? Well, of course, number one at the top of the list is erectile dysfunction. Approximately 50% of 50-year-olds have some form of erectile dysfunction, whether it's difficult to achieve an erection or to maintain. And it just goes up from there. We say about 60% of 60-year-olds, 70% of 70-year-olds, and so forth. You get the idea. Even 40-year-olds, a large percentage are having some issue with erectile dysfunction. And it is, of course, very disconcerting to a man and to his wife. And we're going to talk about some of the reasons and what you can do to treat that. Another big issue is decreased libido, just a reduced interest in sexual activity, just really not feeling that desire to have sex, not just feeling kind of tired and not interested, don't really care, could live without it. That's not normal. A healthy libido is going to help lead to better health and should be addressed. And then ejaculation disorders like premature or delayed ejaculation. So these are issues where either it's too quick or it's taking too long, and both partners get pretty frustrated when that is the case. So what are some of the reasons that men have issues with erections, libido, and ejaculation? Well, hormonal changes are a biggie. Really big. So the decline in testosterone levels is huge. And it goes down 1% per year starting at age 30. So by the time men are 40, 45, 50, they're really noticing a difference. They're noticing the effects of low testosterone, and things aren't working the way that they used to. So it's very important to consider that. Another one is chronic health conditions, diabetes, cardiovascular diseases, things that oftentimes go along with being overweight or obese lead to erectile dysfunction. You get less blood flow to the area, and things don't work the way that they should. The erections aren't strong as they should be. Psychological factors, stress, depression, anxiety, all of those can impact your sexual function and make you not feel like having sex and being distracted so that things don't work right, hard to focus. And then, unfortunately, a lot of the medications for depression, such as SSRIs like Cymbalta or Prozac, Zoloft, can decrease your libido further, thus exacerbating the problem even more. And then lifestyle factors, smoking, alcohol use, being sedentary, watching watching pornography at all, any of that can really impact your sexual function. You're not taking care of your body properly. You're impacting the function of the blood vessels, the nerves, by not nourishing your body properly. So these are very important to consider. And of course, pornography is known to impact men's sexual desires and ejaculation and erections in a very significant manner and should be avoided. Treatment options. So there are, of course, several treatment options for erectile dysfunction. One of the big ones that we all are familiar with are the medications, the little blue pill, and the category is called phosphodiesterase 5 inhibitors. So they enhance blood flow to the penis. They dilate the vessels so that the penis will fill up with blood more quickly, more easily, and you'll get a firm erection. And these can be very effective. Testosterone replacement therapy is really important if you have low testosterone levels. I encourage you to get that checked if you're struggling in this area. Not only will the testosterone help you sexually, but in so many other ways, it'll help your health. You can see my other videos and podcasts where I talk about the power of testosterone therapy. Really, really important and very foundational as well. Another novel treatment, although it's not so novel anymore, it's been around for quite a few years now, and there's just increasingly compelling research coming out about soundwave therapy for erectile dysfunction, where we use a low intensity sound wave treatment on the penis, and it stimulates blood flow to the penis, causes the blood vessels to increase in number and the nerves to increase as well. A series of treatment, really pain-free, is very effective. And then especially if it's paired with pelvic floor exercises, that's going to improve blood flow to the whole pelvic area as well. Really loving the results with the soundwave therapy. It is important to look for the really good stores machine like we have in our clinic. You don't want to have a second rate machine. Number one, it hurts more. And number two, it's not as effective. Other treatments for erectile dysfunction, vacuum erection devices. These are mechanical pumps that go on the penis and they induce erection. So it just literally physically, mechanically pulls the blood into the penis. And then you put a little rubber ring around the base of the penis to hold the blood in. So these are probably the cheapest, easiest, quickest way. Although I get feedback from men that a lot of men don't like them or they hurt. So it's not our number one recommendation, but it is a possibility. There are some penile injections and suppositories that are administered directly to the penis. The Trimix is a compounded medication with several different factors that improve the blood supply to the penis, and it's injected into the side of the penis. It is very effective. There's a risk of priapism, which is where the erection is too strong and it doesn't go down. So they need to be used very judiciously and cautiously and under supervision of a urologist. And then for severe cases, there are penile implants. I did a lot of these in my residency at Baylor. They are mechanical pumps that are put into the penis, the core of the penis, and the pump is in the scrotum. So you just squeeze the pump, a few pumps, and it'll transfer the water into the penis and then into the chambers of the implant, and the penis will become erect. So that's sort of the very last option, because once you do that, there's no going back. Now, lifestyle modifications. I'm really big on lifestyle modifications because it will take care of so many issues. starting to exercise regularly. That will improve blood flow to the pelvic area and reduce your erectile dysfunction symptoms. Get moving, get exercising. It's time. Diet, healthy eating habits. Eating a plant-based diet is going to support your overall sexual health. You're going to feel better if you can lose weight and be healthier. You're going to have better sexual function. You're going to want to have sex more. You're going to feel better about yourself. Stress management, mindfulness, working through any issues that you're having, any psychological barriers that may be impacting your function, your relationship health, and like I said, really getting to know God and having a relationship with God will tremendously help with stress management. And then avoiding tobacco and excessive alcohol both negatively impact sexual function. They're both going to really accelerate the degeneration of the penis and the hormonal impact. Now, there are some supplements that you can take that are very good for erectile dysfunction and libido. Um, I like to test my patients and really know which supplements they're low on. But short of that, if you just want to go ahead and take some supplements that are good for this area, vitamin D is very good for hormone regulation and blood circulation. L-arginine is an amino acid and it boosts nitric oxide and circulation to the penis. Nitric oxide is a powerful vasodilator. So it's going to make the blood vessels dilate and accommodate more blood flow. Zinc is important for testosterone production, and vitamins B9 and B3 support vascular health. Now, all of these, you must use them as directed. I would get medical grade supplements that you know that the active ingredient is in there and that they are accurately dosed. And you don't want to overdose on these, especially the B vitamins. That would not be good. I also want to encourage you to think about psychological and emotional considerations. If you're having some mental health struggles with depression, anxiety, then you want to address that. And at the same time, understanding that sexual dysfunction can also lead to decreased self esteem and relationship strain and just not feeling like things are going well, that you're not really happy with the way things are turning out. So they kind of play off of each other. They all kind of need to be addressed at the same time. It's really important to have open communication, open discussion with your wife and your doctor to get the best outcomes possible. It's hard. I've observed over the years doing sexual medicine that once this becomes a problem in the marriage, it oftentimes doesn't get addressed and discussed and begins to get very emotionally charged. And it becomes harder and harder and harder to bring it up and discuss it. So many couples just ignore the problem and, sweep it under the rug, pretend like it's not there, but it's always there, kind of weighing on them. So the sooner that you can openly communicate, talk to someone, figure out ways to broach this with your wife, or if this is a wife listening, to broach it with your husband in a very gentle, non-judgmental, accepting way. The sooner that you're going to increase your intimacy and be able to start tackling the problem together. So in conclusion, age-related sexual health issues are common and treatable, and I think that you should treat them. I think it's really important to who you are as a person. We're created whole. We're created with a soul and a body, and that body includes our sexual health and our sexual well-being. So don't ignore it. Go ahead and get treated. Try something. You'll really thank me later. Your wife will thank me later. You will have a much better relationship and you'll just feel like you're loving life more. You're enjoying life to its fullest. And that's what I want for you. A combination of medical treatments, lifestyle changes, and psychological support is going to offer you the best outcome. And I am one of many doctors who can help you with that. I'm a urologist. I am focused on all of these issues, the psychological support, I refer out to a sex therapist. I can get you going on this. But if you're not near me, if you don't want to come see me, go see someone, go see a urologist, find someone that can help you with this. And you can get personalized advice. So, for my final tip, maintaining open communication, seeking professional guidance are essential steps forward towards improving your sexual health as you age, and it is very important. Thank you for tuning into this episode of LifeSculpt by ChristiMD. I hope you found our conversation as inspiring and enlightening as I did. If you enjoyed today's episode, please be sure to subscribe, rate, and leave a review on your favorite podcast platform. Your feedback helps us reach more listeners and spread the message of living a life sculpted by health and happiness. Don't forget to follow us on social media at LifeSculpt by ChristiMD for more updates, behind-the-scenes content, and to join our amazing community. And follow my personal account at Love Life Medicine for more great health and inspirational content. Until next time, remember to prioritize your well-being and keep sculpting the life you love. And don't forget to get to know God. He wants you to be happy and to have inner peace.